Swan-Ganz catheter. Why do you use it? It is used to measure what? Is a very important question. So, it is a pulmonary capillary wedge pressure. To measure that, we use the Swan-Ganz. So, you have a right atrium, right ventricle, left atrium, left ventricle. So, when you pass the catheter into the right atrium में pressure उतना नहीं रहता. So, the pressure curve will be like this in the right atrium. A wave, C wave, B wave, X descent, Y descent is something like that. Then, when you enter into right ventricle, you can see the systolic and diastolic pressures. Then you will be entering into pulmonary artery from right ventricle, and ultimately you will be passing that and reaching the point of where will pulmonary artery end in? It ends in pulmonary capillaries. So pulmonary capillaries ultimately become pulmonary vein drains into left atrium. So you will be passing the catheter through the pulmonary artery until it reaches the pulmonary capillaries and stop there. So the pressure at the pulmonary capillaries is an indirect reflection of the pressure in the left atrium, is what you have to remember. So if there is a left ventricular failure, what will happen? That will increase the pressure inside the left atrium. That will increase the pressure, pulmonary capillary bed pressure also increases, is what we need to ultimately remember. So this is a very, very important point. Give me the board. So Swan-Ganz catheter, effectively, what is it testing? You have a right atrium, left atrium, right ventricle, left ventricle, and you pass the catheter from right atrium into the right ventricle, right? From the right ventricle, what is coming? The pulmonary artery is coming, so you pass into the pulmonary artery. Ultimately, pulmonary artery become the capillaries, and capillaries become pulmonary vein. Pulmonary vein comes and drains into left atrium. So when you are wedging against the pulmonary capillaries and calculate the pulmonary capillary wedge pressure, it is indirectly reflecting the pressure in the pulmonary vein and the left atrium. So whenever left ventricle fails, the pressure in the left ventricle shoots because it is unable to pump the blood into aorta. And that increased left ventricular pressure will reflect as an increased left atrial pressure. And the increased left atrial pressure goes back and causes an increase in pulmonary capillary wedge pressure. And when the pulmonary capillary wedge pressure, capillaries में pressure बढ़ गया तो क्या हो जाएगा? It leads to development of pulmonary edema, is what you need to remember. So Swan-Ganz catheter is measuring pulmonary capillary wedge pressure, indirectly the left atrial pressure. And CHF is identified by increased pulmonary capillary wedge pressure. There is one more situation which is called ARDS, acute respiratory distress syndrome. इसमें क्या हो जाता? The left atrial pressures are normal, left ventricle did not fail, but the pulmonary capillaries, they become very leaky. Their vascular endothelial permeability increases in ARDS. And because of that, there is a development of pulmonary edema. But what is the difference between pulmonary edema, जो CHF में दिखता है, versus pulmonary edema that you see in ARDS? Pulmonary edema that you see in CHF, there is a increased pulmonary capillary wedge pressure, but the pulmonary edema that you see in ARDS, there is a normal pulmonary capillary wedge pressure in ARDS, is what you need to remember. So, another important difference. If there is a left ventricular failure and pulmonary edema, then on X-ray, there is a cardiomegaly, the size of the heart diameter increases. Whereas in ARDS, the left ventricle is normal, there is no rise in the pressure. That is the reason there is a normal cardiac size in case of ARDS, is what you have to ultimately remember. Khush ho gaya, Mogambo. Yeah. Can you give me back the board? Slides? Yeah. So, whenever you are passing the um, the balloon tipped Swan gauge catheter, it is ultimately measuring the pulmonary capillary bed pressure, and if it is more than 25 millimeters mercury, Somesh is saying it is very dangerous, absolutely. So आपका लंग यहाँ है, कैपिलरीज यहाँ है, पल्मोनरी आर्टरी से ये आके पल्मोनरी कैपिलरी के पास वेज हो गया, and it is indirectly reflecting the pressure inside the pulmonary vein, and the pressure inside the left atrium is what you have to emphatically remember.